Dr. Jonathan Nieves, welcome to Inside South Florida.
Hi.
Your white coat is shining brightly and beautifully in our studio today.
Thank you.
Well, I'm excited to talk to you and learn from you today. So what we're touching on is a specific thing. It's called AFib, and what causes it. Break us down. What is that?
So AFib is an arrhythmia of the heart, and arrhythmia is a type of abnormal rhythm where the heart beats too quickly, too slowly, or irregularly. In the case of AFib, the top chambers, known as the atrium, will beat very chaotically and irregularly. Sometimes that's for brief moments and times, maybe minutes, seconds. Other times it's permanently, and patients are in it all the time.
You talk about that heart rhythm there. Any other symptoms of AFib, and maybe what actually causes it?
Yeah, so the common symptoms, it's a huge spectrum actually.
Okay.
So patients can be completely asymptomatic or have a more severe form where they're in heart failure, requiring ICU admissions. So independent of the symptoms, patients often require medications. These medications may include blood thinners or heart rate slowing medications. But the most common risk factors, which is what you were alluding to earlier,
right,
is really common medical conditions: uncontrolled high blood pressure, diabetes. By far and away, alcohol consumption can lead to atrial fibrillation,
okay,
and then conditions known as sleep apnea, where patients will maybe be overweight and can snore or stop breathing in the middle of the night.
So different effects of lifestyle have a big play on this.
Yeah.
How about any differences between men and women? Is there a difference?
There is a difference. So men tend to develop it at younger ages, women at older ages. However, the symptoms tend to be much more severe in women.
Wow. Okay, so interesting. So to our ladies out there, we need to make sure we are getting all our checks. How about external factors? You touched on the alcohol, stress, smoking, any other of those external factors that we can control and make sure not just the ladies, but everyone is doing their best to prevent this?
Yeah, so some other external conditions, we mentioned alcohol and smoking, but stress and even consuming beverages or certain products that may increase adrenaline, those can lead to palpitations in and of themselves, but then worsen to progress to atrial fibrillation.
Well, we don't want to scare people with this information because Broward Health is doing a great job of preventing and changing the ways that this is treated. What are some of those ways that Broward Health is offering treatment options?
Yeah, so often, as we mentioned, lifestyle changes is of utmost importance, but then some patients need medications and other progressive needing procedures. Those procedures were only offered traditionally at centers of excellence, and maybe patients had to drive hours to get to them. Now, Broward Health is offering them not only in Fort Lauderdale, but our satellite hospitals like Coral Springs Medical Center and Broward Health North. Those procedures are cardioversions, pacemakers, and even ablation procedures.
So if needed, Broward Health is there to help us, as always.
As always.
As always. We appreciate the great work you guys are doing. Where can we go for more information?
Yeah, so browardhealth.org/heart will lead you to our website, and then fine-tune there to find atrial fibrillation, and you can find all of our contact information.
There you go. Dr. Nieves, thanks so much for coming into ISF
My pleasure.
and helping us stay healthy today.
Stay healthy.